The next step in treatment after a patient has gone through surgery really depends on the size of the colon cancer or the tumor. The larger the tumor, the more likely someone's going to need to have further therapy, namely chemotherapy. If the tumor is a stage 1 colon cancer or a small tumor, all the patient needs is a resection of their colon and they're cured from their disease. They can go on and now have their follow-ups at defined intervals in the future. If the patient has a bigger tumor or a stage 2 tumor or cancer, then they may be a candidate for chemotherapy. It's a gray area whether or not to treat patients with stage 2 cancer with chemotherapy, and there are a lot of risks and benefits of doing it. I personally use a test called the Oncotype DX to determine if patients with stage 2 colon cancer are going to get a benefit from being treated with chemotherapy. And if they fall with a certain score on that test, then I'll send them to the medical oncologist to talk about chemotherapy. If a patient has stage 3 cancer or a stage 3 tumor, that means the tumor has gotten bigger in the colon, but then it's also spread to those lymph nodes that are in that curtain. And if those lymph nodes are involved, then the patient's definitely going to need chemotherapy because the risk of recurrence and the risk of spread is a lot higher. Chemotherapy for colon cancer can last upwards to 6 months. However, the chemotherapy you get is not the chemotherapy that makes your hair fall out and gets you really sick. It's not a walk in the park, but it's not as bad as some of the other chemotherapy regimens that are there. And then stage 4, typically chemotherapy has already been discussed before surgery, whether to do it up front or to do it afterwards. So the patient's usually pretty aware of what to do at that point.
For an interactive tool to learn more about your colon cancer and your personalized treatment options, go to mycoloncancercoach.org.